Hi, Joe.
Hey, Lane, how are you? You got me yawning there.
We are recording already, so your yawn and all of my futzing around here in the chat box is all in the permanent record.
Oh, sounds like fun.
And I just got a terrible, like, vertigo headache right before I know. It's okay right now.
That's not good.
Yeah.
Wow.
Can see your heavy bag again.
Yes, I've not used it in a while. I did a lot of work out in the yard again. Really, it's not much of a yard. It's more in the fields, pulling up invasive shrubs and cutting down stuff. So for some reason, my neck has been stiff.
Mm-hmm.
So this good, Greg, getting old stuff gets really sucks.
And gardening is for the kids.
Yeah, I came in and I was fine, and within a couple of hours, my shoulders and my neck were stiff, and I said, "Oh man, I thought I would be fine."
I'm sorry. It's so exciting when like yard work is fun and it's exciting. And whenever I go out there, I think the time just gets away from me and I don't notice these, sitting in one position for 5 hours and forget that we're not 12 anymore.
No. I mean,
I'm sorry.
I mean, and for me, I'm using a hatchet and I'm using a pick to pull this invasive stuff out. I mean, it's every spring. Now that the boys are older, we do it. I mean, but it's just, I've been doing it for the past 16 years, but this time around just seems a lot harder.
Oh, this year.
Yeah. This year just seems a lot harder. I don't know.
Yeah.
So yeah, it's been, so I've been doing a lot of stretching. No punching, just stretching.
Do you do yoga at home?
Yes, I try to. I mean, I don't do a formal go through it. I just do as much. I mean, like when I'm sitting down, like probably right after the meeting, I will get on my mat and do something. But that's it.
So you're just doing the stretches that are specific to the pain.
Yes.
Oh.
Yes.
Yep.
It's very pain specific.
Not completing a program. It's not goal oriented.
No, just pain specific. Just hey, this is what's going on right now. So I will do that. Well, let me see if I can trying to see how I can bring up my the agenda on the side.
Oh yeah. We have Elise Belknap and Diane Zell and Gail Rainey already here. That is nice.
Okay, so I think I can do that. Oops. Okay, I can't seem to be able to put it. So let me see if I'll shrink you. Oh, no. Let's see.
I'm gonna duck out for just a second.
Yeah, no, go ahead. I'm just going to play around with this so I can see how I can get the schedule on here. Okay, I'll do it this way.
Hi, Joe.
Hey, how you doing?
Oh, pretty good.
That's good. That's good. So how you guys dealing with all this stay-at-home stuff?
Just wondering why we couldn't have done this years and years ago. This is this late in my life.
Because it was illegal.
It was illegal way many years ago, and we didn't have the technology.
I think when the emergency declaration ends, we will have to go, we'll have to have some, at least a majority of, no, we have to have a quorum in the boardroom physically. And then other people can join this way. But
this is the boardroom, isn't it?
right now it is under the
Just the
emergency
boardroom, yeah.
declaration. This is it.
No, under the emergency, this is it. But
Yes.
after the emergency is done, they would have to have a physical quorum, and the rest is
right?
And then according to your
my laptop, I was too far from the router.
So your bylaws allow for participation, the maximum virtual participation under the law until the emergency started. So what it means is a quorum has to be present in the physical room, and they have to vote to allow other people to participate remotely. Yeah.
Interesting.
Yeah. Maybe that law will change.
I don't know about that. I mean, lots of things move at a snail's pace.
You're right.
Hi, Julian.
Julian's on?
Yeah.
I'm on now. Yeah.
Hey.
Can you hear?
Hello, everyone.
Hi.
Hey, Sandra. How are you?
Hi.
Okay. How are you?
Pretty good.
Good.
How you doing, Chandra?
I'm doing okay. How are you?
Doing well, doing well. So we're still waiting for several other people?
How many do you think are here?
It says there are 13 people on right now.
No, I mean board members.
Oh, board members.
Yeah.
Just for 3, 4, 2, yeah, 3.
Well, usually when I come to these meetings, I worry about getting here on time because the traffic is unpredictable. But I'm not having any trouble getting through the traffic from Champaign.
Oh, it's terrible traffic at my house, though.
So how many people do you have living there, Julian? Just
one other person.
I know.
The others who used to live there deserted me.
They decided to have a life of their own.
Yeah.
What's wrong with these kids today? Huh?
I don't know.
Can someone remind me where we left off the other day so I can get queued up here?
Grow is next, I believe.
Yeah.
Yes, grow.
I think we're up to page 112.
Yes, 112.
Good evening, everybody. This is Mark.
Hey, Mark.
No video for me again this week.
Oh, come on, I want to see you, Mark. I don't want to just hear your voice.
I was looking forward to seeing you without a tie.
Yeah. Well, I
He
don't
wears
have
a tie all the time.
But yeah,
Susan and Elaine are here. Hello.
Hi.
Julian, I've given up the tie for working at home. So no
Okay.
jacket, no tie, but I still got the khakis on and dress shirt.
Okay.
So still presentable.
You're almost as casual now as Stephen Colbert.
Yeah. Yeah.
Thank you, Chandra, for keeping the pace and keeping the time last time. Appreciate it.
You're welcome.
Okay.
Prepared to serve again today.
Sounds good. Thank you. Thank you. Thank you.
You still want 7 minutes or do you want
Yeah.
10?
I think 7 minutes worked well the last time, so
Okay.
we just keep it at 7.
Okay.
So who else are we expecting that is not on? Yeah, I know Kathleen is not going to be here. Oh, Susan's here.
Should we do a roll call?
Elaine is here.
Do we have a quorum?
Yeah, I think we do. So, and Kyle's here, so I think we have a quorum. So let's call to order. Is Deb here? So who's doing the roll call?
Stephanie.
Stephanie. Oh, okay.
Yeah.
Is Stephanie on?
Yes.
Yeah.
Oh, okay.
Her mic is not on though.
Susan Fowler,
Here.
Tom Moore,
Yeah.
Joe Omo Asagye,
Yeah.
Elaine Palencia.
Your mic, Elaine.
Yeah. Elaine's here, but she's muted.
Sorry.
Okay.
Kyle Patterson,
Here.
Julian Rappaport,
Here.
Jane Sprandel,
Here.
Kathleen Worth Couch, John Paul Joachim. Well, there's a quorum.
Okay. So before we, okay, public participation and citizen input, do we have any right now? Or we just move on?
It doesn't look like there's a raised hand.
Okay.
Is that right?
Okay. That is correct.
So let's move to approve the agenda.
I so move. Second. The agenda.
Second.
Okay. All in favor?
Aye.
Aye.
Thank you. So I really don't have a lot of comments, but what I have is that if the agencies have something that they want to have as an input, they can wait till we're done with going through the rest of the packet before we have agency input. Would that work?
Do you want to do that after board announcements or before board? Okay.
After board announcements.
Okay.
I don't have anything else to add as a comment right now, so we can begin the discussion of summaries. Who had GROW?
I have that, and I think Tom is the second reviewer. Is that true?
Yep.
Okay. So GROW is a program that we have been funding. I believe this is either the third or the fourth year. It's a 12-step program. It started in Australia. It's evidence-based. The majority of participants in the program have prior hospitalization for mental health concerns. Purpose of the program is to connect people, to form a peer support network. The GROW program staff conduct weekly meetings in Champaign, Urbana, Rantoul, and they've expanded this year prior to the pandemic to including both a male group and a female group in the Champaign County jails. They also have a monthly group at Church of the Living God and at the Champaign County Christian Healthcare. In addition, they have monthly socials for their members. There are alternative plans during the pandemic. I emailed and asked questions. They have moved to Zoom meetings and to Zoom social gatherings, and of course, have not been able to conduct the meetings in the jail at this point in time. Prior to the pandemic, by the end of their third quarter, they had served 2 individuals, which is 210 that they had proposed serving for the 2020 year. They note that the turnover in the jail is quite high, and much of that relates to the length of time that people are in the jail or not in the jail. They are for data collection. They're looking at the frequency of weekly meeting attendance, and approximately half of their attendees come 4 to 5 times a month, and roughly 40% 1 to 2 times a month, and maybe 10% 3 times a month. So they have fairly good attendance for a significant group of their participants. Their outcomes are to reduce hospitalizations, medical usage, increase social resources, personal growth and well-being, and increase leadership roles among the participants. They have some difficulty with data collection in that they undercount because you have to be present on the day that the survey collection is conducted. They're hoping to work with the UIUC evaluation team to move to responding online, which would reduce that inherent bias of if you're not there, you don't get to provide a baseline or a survey response. Their budget proposal is requesting a 16.5% increase, moving from about $90,000 to $122,000. The Mental Health Board currently is the sole funder. They did engage in a collaborative proposal called the Living Room in coordination with Rattle the Stars for IDHS funding, which was not successful in its review, in part because they were learning how to do the proposal process and left out some key information, so they weren't eligible, but they intend to try again. They fund 1.5 positions. These are field workers, and they have a in-kind contribution from their coordinator, Chris Storr. So it's a program that has been in place for the last couple of years. It's trying to expand, was successful in expanding to the jails. It has been effective in increasing service contacts, the number of people served. They had 1,132 contacts, which are based on actual attendance at meetings and socials and they are looking for more help with their data evaluation. So I think the issue really is to encourage them to continue to seek other funds so that they're not solely reliant on the mental health board. And that may be an issue in terms of the increase in funding, but I leave that up to the staff. Tom?
I don't have much to add to that, Susan, other than I think that what you pointed out is that they are a 12-step program and they meet in groups. So it's a face-to-face group that they work in. So for them to do all the things that they plan on doing, including reaching out to the rural areas and expanding in the jail, they're really going to be hampered in being able to set these kinds of group meetings. So that's going to be difficult to see how they handle it. One thing I did want to point out is that I think because it's GROW and it is a 12-step program and it is peer-led, their commitment to dealing with anti-stigma is really great. And I think that they do a very good job as part of their mission to make sure that people understand what this whole stigma brings for people who are suffering or been at least accused of suffering with mental illness. So I think for all of our programs, that's a key issue, but they do a very good job of attacking that. Other than that, I don't have much to add. I do think it is great for them, since this is the kind of program it is, for them to hook up with the evaluation program. This is a great time for them to start identifying data, and not just with their program, but just in general about their people who come to the groups. If we could encourage them to do that, I think that would be really helpful. Other than that, I have nothing to add.
So, I mean, I like the fact that they tried to do some work with Rattle the Stars, because I think one segment of a society, of a community that we don't have, the adolescents.
Right.
And there are quite a few young men and women who have been hospitalized and could benefit from something like GROW. I know several years ago, I was in discussion with GROW to get a youth group started, and I hope they still are able to do that eventually.
Joe, I just wanted to let you know your time was up.
Okay, thank you.
Mm-hmm.
Okay, it's the next organization is Macy, the Muhammad Area Youth Club. So who had that?
I was the second. I can go over it if the primary reader is not here.
You know what? It was Kathleen Worth Couch is the primary reader, and she's been trying to get Zoom to work and wasn't able, and sends her regrets this afternoon.
Mm-hmm. So for the Macy members matter from the Muhammad Area Youth Club, they're asking for $40,513 for funding this year. Their total budget is $177,673. They're asking for an increase of 125%. Basically, they provide programs for 6 to 17-year-olds. They serve the Muhammad area. It's after-school programs, as well as during the summer and then winter and spring breaks. They take any student. It's inclusive, but they try to target low-income families. About 20 to 25% of the community in the Muhammad area is low-income households. 50% of the students that they enroll qualify for a financial scholarship, which I didn't specify in the application, but we assume it's low-income families. 70% of the junior high program that they have qualify for free and reduced lunch by the federal guidelines, and they have 2 staff that help develop social and emotional skills and support for the at-risk children. That they work with the principals to enroll struggling students into the program. They have in the program they help them study. They have games. They have STEM-related activities and projects on arts and crafts. The goal is to increase their physical health and their mental health. The funding is for the programs of the club when school is not in session, again, during those times of the year and after school. And then funding is for the part-time staff. Their increase in funding, it looks like, because they served about 73 people in 2019, and so far in the first half of 2020, they've served 155 individuals. Their outcomes, they have that 90% of the children involved have moved on to the next grade on time. 80% have had a passing grade in math, science, and English. The only issue is I don't know if these are markers that you can use for this program. There's a lot of other factors that play into that. And it depends also on the proportion of kids that were higher risk for passing on to those grades, or not passing on to those grades, or not having passing grades in those fields of math, science, and English. So I don't, it's harder to assess whether those markers are a good sign that the program is beneficial or not. They have other sources of contributions from like United Way. They have membership dues. In the summary, they were saying that there was about a $5,000 discrepancy, and I wasn't sure where that was specifically when I was looking at the numbers. The cost is going to 8 different programs, ranging from funding 51% of the program director full-time, as well as other charges. They don't refuse students, so like if anyone can't pay, they're not going to refuse them from the program. So I mean, it seems like a great program for kids after school, providing a myriad of different activities. Helps them, it seems like it helps them build social development and building relationships. And I think it's a good program from the application. It would be nice. I don't know if someone's from Macy to maybe first describe more about what they do for the mental health aspect of the children specifically. It kind of talks about the things indirectly that would increase the mental health, but I didn't see like specifics about what directly they would be aiming to increase in the mental health of the students.
Okay, Susan has her hand raised, Joe.
Okay, go ahead, Susan.
Well, we've funded this program for quite a while, and we're funding another component of the program under the 2-year program plan. So I would just raise a concern that I have for a number of the programs. It's not specific to Macy, but many of the programs are asking for substantial increases in the level of funding. And I suspect that we do not have as much money as is being requested. And so I do have some concerns about the increase amount being asked, given the amount of increase over past history. And I'll just leave it at that. It is the only source of funding.
Okay, thank you.
Thank you. Joe, do you want someone from Macy to answer?
Is there someone from Macy with a hand up right now?
Not with a hand up, but there is someone here. I did see Sarah on the call.
Hi guys, yeah, this is Sarah and I'm on if this is enough time to speak.
Sure, go ahead, Sarah.
Thanks. Thank you so much for that. So I think the 2 questions I heard were outcome measurements in addition to grades and academics, mental health supports, and then like why the increase in the amount. So I'll try to cover those real quick. The outcome measurements are really junior high after school focus that we provided with grades and other components. As you guys might guess, having other outcomes related to academics for out of school summer programming and things like that is a little challenging to measure. We've been mostly capturing, you know, kind of qualitative data from parents and families about student engagement, kids' behavior at home, and you know, ways that we're supporting them by giving them opportunities to have recreation and other things at the club, connection with their peers. For the mental health component, we are not experts, so we have partnered with others and had Courage Connection has come out and done some groups with the kids to talk about healthy relationships. And we have partnered with a local counselor who's been leading a girls group. And the girls are, for the junior high are really excited about that. We, of course, also just really feel like the connections with families is helping. So parents feel open and able to call us if their kids are going through things and or to discuss what might be going on. And we partner often in plans to help them through that, as well as with social workers at school. And then the big increase request this year is because we have not previously had a full-time program director. It's always been part-time, and that was really challenging to keep consistency and quality in the programming. And so that's where that big increase is coming from, is in addition to the numbers of kids have really increased in the past year as Muhammad continues to grow, especially in the low income bracket.
Thank you, sir. I know I'd mentioned that I wanted input at the end of the meeting, but I kind of did not see that but let's go on. Thank you.
Okay,
Any other comments?
Okay, so you just would prefer it to be at the end?
Yeah.
Verse. So no questions will be answered until the end of the meeting.
Just we would write the questions down, and then at the end would hopefully they'll be answered by the representatives on who may be around.
Okay, thanks.
The next agency is NAMI. I am one of the reviewers, and I don't know if I'm first or second.
You're first.
Okay. So NAMI is a national organization and locally try to have groups for youth and adults living with mental illness. They're trying to expand to make sure that they get into more of the smaller communities around Champaign-Urbana, and cooperating with several other with the medical facilities around here. They're trying to have much more of a presence, much larger presence, because I mean, several of the different things that go on in the community, there's much more of an involvement in it. And so that's where the increase is, that they want to have much more of a stronger presence in several of the different things going on. The increases seems large, but it's the budget itself is relatively small. So they go from, the funding request is $35,000, which is a 250% increase from the last time. But if they can accomplish what they're asking for, maybe it's something to look at it a little bit and see what else needs to happen. Okay. Elaine, you're the second reviewer?
I'm the second reviewer on that.
Okay.
And I don't have much to add other than it. I hope I'm not doing them a disservice, but given that their priority is a system of care for youth and families, I was kind of focused on, it looks to me like if you put all of their work together, what they do, that they're primarily a clearinghouse of information, referral, training, and they do some work in groups. But as a clearinghouse and working with adults and children and families, I don't know if we have that kind of entity in the community just yet. So it sounds like their work is pretty critical at this particular point, especially if we want to make a an impact on children. And given our current situation with the pandemic, not knowing when this thing is ever going to lighten up, someone who can serve as a information source and doing referrals is absolutely critical for how we're going to get through this time. So
yeah,
that's about all I have to add.
Yeah, I mean, just to add just one more, I mean, that the executive director currently has been in lots of different community events, and I think that's one of the ways in which they get information out. I don't know if I mentioned it in this group last time, but some of the research is showing that the next pandemic would be mental health, and NAMI will be a part of that, would be part of the answers that we'll get. Any added comments? Or?
This is Susan. I would just note that this is year 2 of the funding, and so it's a major increase over year 1.
Yes.
Even though the initial funding was low, this is a national organization. It does not exist in every community, so we're very fortunate to have an active NAMI in our own community. And so I would just caution again that we have more requests for funding than we can possibly meet. And so it'll be staff recommendation.
Yeah. Oh, definitely. I mean,
Thank
because
you.
they asked for it doesn't mean they're going to get it.
Yeah.
Jane also has her hand raised, Joe.
Go ahead, Jen.
So on a personal note, I currently am taking part in the family to family group. We have had to go to doing it as Zoom meetings ourselves. Honestly, I think the biggest thing they need is people in the community need to know it's out there, because this is going to be a huge pandemic in our community. You know, I have a son who's bipolar, and let me tell you, you coop someone up with their family for week 5 or whatever, it's hard on the family. So again, I understand the purse is only so big, but I definitely think this is something we need to really see if we can support to help them, because what they're giving to our community is really invaluable. So
yeah, thank you.
There are no other hands raised.
Okay, thank you. So moving on to Promise Healthcare, mental health services of Promise.
oh, that's me.
That would
And
be.
I think I'm the primary on this one.
Okay.
All right. So they are looking for an increase of 44.5% this year. So, you know, obviously something we have funded in the past. You know, so currently 74% of the patients in 2018 fell below the federal poverty level. You know, we recently had a presentation from them and talked about who majority of their clientele are. Obviously, we know that even though we have some major employers in the community and a Big 10 university, we have a lot of poverty in our community. So at this point, about 800 to 1,000 of their patients are prescribed a behavioral health medication by the primary provider there at Promise. So definitely they know this is somewhere they can go to get the needed medications and some other help there. The big thing I think this increase is going to provide is an AR claims specialist. And that is someone who's going to work on processing these behavioral health claims that are denied by Medicaid, managed care organizations, and other payers. So they're trying to help get the federal money that's out there, and you know, and that's what a lot of this is going to cover, is to cover that position. 20% of the clinic people who use it are from outside of Champaign, Urbana, and Savoy. So I do feel like it has a nice rural reach, which I think is, you know, we've always known that's one of my big things that I like to see. You know, obviously this is a service that's available to anyone, regardless of their ability to pay. I think that's something important that our, you know, tax dollars need to go to help support. You know, they do have some mental health services. It's currently done word of mouth for family and friends to get some added support. And hopefully that's something we can get some of the other groups, such as NAMI, involved in that too, as far as, hey, here's another free service. So they anticipate this calendar year to have 2,100 total participants. It's quite a lot. Promise does screen for depression as part of all of their medical visits throughout the year. So,
Joe, I just wanted to let you know that the 7 minutes is up. Like I said, I just wanted to give you the time.
Okay.
Thank you.
Sorry.
Keep going.
That's okay.
Yeah. So they did have a child psychiatrist available through Carl, but it is no longer available. And I think that was something that our speaker brought up the other day. So I guess, sorry I took up so much time.
No, it's okay. Who is the secondary?
I am.
Okay.
As best I could tell, I have no objection to this proposal. And as best I can tell, it looks like the money's going to be used for like 2.3 FTEs that they're going to be adding. So their work is mainly in delivered by other personnel, and that's what they need. One comment I did want to make was this is a very well prepared proposal. They did a very nice job with it. So I have nothing else to add to that.
Yeah, thanks, Tom. Thanks, Jane. Any comments before we move on? Okay, thank you. So moving on to Promise Healthcare, Promise Healthcare Wellness.
We just did
that. Kyle's the primary.
Yes, and yeah, this is a different program at Promise Healthcare. There is a program that we have continued to fund. This year is actually an 86% increase. Seems like it's mainly, I mean, the program, 100% of it is personnel. They provide, it seems like case management for people who are specifically have mental health issues to help connect them to different resources. Seems like they went, what we're funding went from 1.5 full-time employees to 2.43, and it's kind of a smorgasbord of paying for 50% of 25%, 20% of different people. Seems like a solid program. We've been funding them for a while. I didn't really have a lot to add.
Okay, thanks, Carl.
So I'm the secondary reviewer,
Okay.
and I guess a few things that I would add is, so they're asking for basically a $50,000 increase. They have significantly increased contributions and other federal funds dedicated to the program. So although they're asking for more money, they've also done a good job of leveraging, which is something that we do look for when proposals expand. One of the things that I think is important to note is that they work closely with Rosecrans. They provide services at the Walnut Street satellite unit for Rosecrans, so that those receiving services at Rosecrans can establish a medical home through Promise or Francis Nelson. And that then also then provides them with access to psychiatry, because Promise Healthcare is the federally qualified health center. So I think it's a fairly important component of the program. They enrolled 2,200 people in coverage, which was astonishing, I think. And they are collecting outcome data. They're working on a system to record the, to create an appointment and log number and type of assistances that patients are receiving that could be looked at in the future. So, so I thought it was well written, and I was positively predisposed given their leveraging and their collaboration. That's it.
Thank you. Thank you. Okay. Any comments? Any added input?
There are no hands raised.
Okay, let's go on to the next one. Sexual violence counseling.
That's mine.
Races.
Yeah, for races, we already are funding a continuing grant for their education program, sexual violence prevention education. So this is a new grant that they're asking for to partially fund a 5th full-time counselor at their Urbana location. And then they're hoping the balance of funding that position will come from the Attorney General's Victims of Violent Crimes program. I was wondering, the application says that program awarded them $22,000 last year, but they were not able to take advantage of it. I was just sort of wondering about that. They have a waiting list already of 25 people for a 5th counselor. So it certainly is needed. And although they serve a 4-county area, the funding for this is they're going to get other funding for the people outside our county. So this money that's being asked for, which is $35,700 for the counselor, will be serving people in Champaign County. There was mention somewhere in the application that they had not been successful in finding a Spanish-speaking counselor. And so I just wonder if this position, they'll again be looking for that. Staff had a couple of ideas about tying this to this grant to just specifying the proposal specifies that there's a waiting list, but maybe specifying that it does go for new clients, and that also that maybe tie it to participation in the crisis intervention team steering committee. This and also making it contingent on those Attorney General funds. I think RACES has done a very good job of looking elsewhere for funding at the state level, and while they show a surplus on this budget, they're say that is in order to have a reserve fund. And I think every single agency ought to do that. I mean, we've been through so many different things, like the 2 years when the state didn't have a budget and so on, when you really, and now, the uncertainties now, that I think it makes sense to have a surplus somewhere, or to start an endowment for your agency or whatever. So that did not bother me. I think that it looks like the need is really here, and they have a very well developed cultural literacy plan. They mention that they work closely with the LGBTQ groups in town, because that population is very vulnerable to sexual assault, and They don't mention the UP Center, but I wonder if that's what they mean by that. I think that's a good connection for them to make. So I feel like they're doing everything right, and they're not asking for a great deal of money for a need that has already been identified. They are also looking into refining their assessment tools. So I always like to see an agency that's not standing still, that is refining its mission and refining its techniques, and they seem to be doing that. And they're really, we fund several unique programs, and this one is unique in that it's the only agency in the county dedicated to helping victims of sexual violence. So it's just one of our core programs, I would say. That's all I have.
Thank you, Elaine.
So Joe, I just wanted to let you know the 7 minutes is up. You can continue however you choose. I just wanted to let you know.
Is the secondary person here today?
No.
Okay. Does anyone have anything to add to it? And I know during the budget crisis that we had a few years ago, they almost went out of business, and I wasn't part of a board then, but I remember being part of some of the fundraisers.
Mm-hmm.
So it's something that we've got to find ways to keep in our community and find ways to keep having them leverage their funds.
Yeah.
Thank you very much. The next one, Rattle the Stars.
Kyle.
All right. Yeah, it's Rattle the Stars. This is a currently funded program. Pretty big increased request for an additional staff person. This group primarily does is the target population is middle school and high school age youth, and also the secondary target population are parents, educators, service providers, and other adults who interact with these youth. And it's a group the goal is to do different trainings to bring awareness to warning signs for suicidal ideation, suicidal behavior, and best practices as far as interventions go. I like this program. It's pretty creative. It's like they had to cancel their trainings for, I think it was March through May is what said in Lynn's memo. Looks like they're looking at doing some types of online trainings, but I think there's some roadblocks as far as it being permitted to do the youth trainings that are targeted towards students online. So I guess that would just sort of be my question of what that barrier is exactly. But that's pretty much what I have. And I know that the other reader is not here or having technical issues.
Okay. So does anybody have any questions? Any board members have any questions or comments about Rattle the Stars? I know in the past year they're still very involved in doing work with survivors and also doing a lot of training with parents and faculty. If there are no comments, we'll move on to the next, which is Rosecrans Crisis.
I believe Kathleen might have been the first on this. Is that correct?
No.
I have spent now.
Was I number?
I think you're the primary and Kathleen is secondary.
Okay, that's fine.
Okay.
So it's the Jane show. Here we go again.
Jane.
They are not asking for any additional funding at this time. Obviously, with Rosecrans, this is one of a few proposals that we're reviewing for them. This is for their criminal justice PSC. So these are dealing with people who have involvement in the Champaign County criminal justice system. If memory serves me correctly, they are getting some intervention in the prisons, or I guess in the jail, and then when they come out, that is already set up so that they can go from one set of therapy services to outside of the prison. So they currently, correction staff completes a brief screening on anyone booked into the jail. And obviously we know that if anyone shows any concerns, those are noted and taken care of. One good thing I like as far as access to services for rural residents is the staff will travel wherever needed when it's appropriate, and to help with those things. It's probably not a surprise, again, overrepresented by people of color and people who are low income and often had little to no access to quality healthcare. So again, it's the snowball effect that we see repeatedly in a lot of these proposals. So the biggest goal that they want to come out of this is increase clients' access to resources. Because we know we live in a community that has a lot of resources, and so they want to help facilitate those. So it is requested that we take care of 68% of the total program for this program. I think it's pretty straightforward as far as, something we have supported in the past, and we've seen how it's a great partnership. Good use of our funds. I thought it was a well-written proposal. So, anyone else?
Yeah, I just have one question about this.
Go ahead. Go ahead. Sorry.
Just one question about the program in general. I don't know anything about it, but I'm curious as, do you have to be incarcerated in order to receive these services, or is there, and I don't expect you to know that answer, Jan, but is there a way that these services can be available for people prior to being incarcerated?
That's a good question. And prevention instead of intervention.
Sort of, yeah.
Yeah, I was thinking they have had incarceration, but I am not certain on that.
Mm-hmm. Well, that's something I would like to, for the staff, would like to, as your
well, and at Joe, at the end, we could always check. I believe Joey King from Rosecrans is here, so maybe he can answer that at the end of our discussion today.
Yeah. Just hold on to that question and we'll see if he has an answer for that.
Okay, I got it written down.
Okay, thank you.
There are no more hands up.
Okay, sounds good. Okay, the next one is Rosecrans Central Illinois Recovery Home. I am one of the reviewers.
No, actually, that's not the next one. The next one is crisis access and benefits.
Oh, I skipped one. Okay, go for it.
Okay, so this is a program. They're not requesting any increase, although it's funded at $203,000 approximately per year, but they're not asking for an increase. And I guess it's been around for a while. It's called Crisis Access and Benefits, and so I'm a little. I guess some of it's straightforward, handling the crisis line with bachelor's and master's level clinicians and so on being available when people are in crisis. Most of their I believe most of their crisis intervention activities in person take place in the emergency rooms. So some of the things that are a little bit unclear to me, and it may be just that I sometimes have trouble following the way these programs interact with one another. So there are other programs in this community that also pay attention to crisis, to access to benefits and so on. And I'm never quite clear how these programs connect with one another, or if they do connect with one another. I'm sure the people involved in it can explain it, or maybe our staff will just know it, obviously. But so it's unclear. It was unclear to me reading it how much this program now has to do with providing crisis care other than in the emergency rooms. There is telephone handling, I guess, as well. So at some point I had thought that this program was intended to be, by us at least, helpful to the policemen on the street when they encounter someone in crisis. The amount of that actually goes on outside the emergency room is also not clear to me. So I'm just not clear on the extent of that sort of service. And it may be unrealistic to expect them to do more than they're already doing for the amount of money that we're paying them, but they also get money from other places to do this work. So we're not the sole funders. Let's see. I don't know if I really have anything else to add to that, except just some need for some clarification of the way these programs for benefits and so on work, and exactly how much crisis intervention is available to law enforcement in the community. I know that they can contact them, but I don't know whether they're actually available in the moment of the crisis when the law enforcement person is engaging. They also, another thing that I've never really been able to figure out, they are funded from other sources, I think, including a contract with OSF for the emergency room. So I don't quite understand how the funding operates. Like if they're funded, if most of their work takes place in the emergency rooms, then in terms of direct intervention for crisis, and they're getting funded from OSF to do that, where do we come in and why do we come in for that? I used to think that we were coming in because the policemen on the street were looking for assistance on the street. So this may be just something that I don't quite grasp. So I think I should stop now, and we could maybe, there's another reviewer, so I should pick up all the time.
Thanks, Julian. So who's the other reviewer?
That would be me.
Go on, Jane.
And you know, I thought I had a pretty good understanding of this, and now Julian, he has me a little confused now too. But how I interpreted it, it is something, yes, that if someone presents in the ER and is in need of some services, they are there to help the person get those resources outside of there and to help the family and things like that. I mean, as far as the police, I mean, it's not like these clinicians are going to a crime scene or anything. I interpret it as the ER has called or whatever, saying, hey, you know, we need some help. Yes, it looks like they have a 24-hour, 7-day-a-week access line for crises. I guess one of my questions was, did this program replace community elements? Is that what it used to be called? Because I thought OSF worked. Okay, so it did. Okay.
So, yeah, Rose
so yeah,
Friends,
and so
yes.
with that, pretty much, yeah, they kind of come in as kind of an impartial thing, you know, person separate from the OSF staff saying, here's what we feel about the situation and here are some resources, and they kind of do the follow-up and stuff of, you know, what can we do to help you get the services your family member needs.
Joe, Susan has her hand raised.
Okay, go ahead, Susan.
Thanks. I just want to go back to the fact that part of what this funds is their crisis line. And we've had presentations from them in the past, and they get quite a few crisis calls. And they have a triage system for determining the severity of the crisis and whether or not to advise the family to go to OSF or to Carl or whatever the case may be. They advise the family in terms of whether or not they should call for backup assistance in terms of ambulance, police, etc. So I don't want us to forget about the importance of the crisis line and the support that they provide, and then their follow-up following the crisis phone call. We don't have anything else like that in the community.
No. And the crisis line has changed a little bit since in the last few years. It's now pretty much being run by clinicians all the time and no volunteers. Right. So it's a little different in the level of experience and the level of education behind the people behind the phone. Any questions or comments? Okay, thank you. Now the recovery home. I don't even know if I'm primary or secondary.
You're primary.
Okay, I will go ahead. The recovery home, I mean, it's not an increase. The request is 100%, 200,000, and it's almost 50% of their total budget. It's a recovery home, which we have not had one in this community in a while, since Prairie Center closed, or since Prairie Center became part of Rosecrans. And Rosecrans has experience in recovery. That was my first experience with Rosecrans was in Rockford in their recovery center. So that's something that they have some experience with. This recovery home is going to be kind of off a bridge or for inpatient. So it's not the intensive inpatient, but it's also kind of a bridge to intensive inpatient treatment. So there's a high level of engagement, but it's also not like a full intensive 30-day recovery. You can stay there up to 3 months. It's a 12-step program base also. And I don't really have much to add. I just think Rosecrans has its hands in quite a few things, and they're trying to look for ways in which they can make all their activities billable through Medicaid. And this is one that definitely could be used a 2-year contract as opposed to just coming back every year. Secondary?
That's me.
Go ahead, Julian.
So my, I think the program itself is fairly straightforward. It follows a pretty standard model for this type of activity, which I think is well-founded.
Yeah.
My questions have more to do with who is served.
True.
That is, again, this may be just, I'm a bad reader. Sometimes these, well, never mind. I may not be following it accurately, so I wouldn't mind some clarification about this.
Okay.
It appears to me that this is primarily, I mean, overwhelmed. Well, there are 2 non-white people who have been served in this program so far. And that is 1 biracial and 1 Native American person. So no one who identifies as African American. Now, obviously, there are other programs that Rosecrans does that have African Americans in it. I don't think that this has anything to do with them not wanting to serve African American people. What I'm curious about, though, is to understand what is it about this program that it ends up, or maybe it's just too soon to see, but does this not appeal to non-white people, or does the program itself need to do more to reach out to engage people from the minority communities into this kind of service? Or just exactly how should we be understanding that? There's absolutely nothing wrong, although Chandra might comment on this. I believe their cultural competence report for the whole agency is quite well done. And it's a big agency, and they're pretty smart about how to handle those things. So I don't think there's any obvious issue here. I just don't understand why they're almost exclusively white folks in this particular program, given the demographics of Champaign-Urbana and where the program's located and what it's for. So that's just a question. I think I'll leave it at that.
Susan has her hand raised, Joe.
I just wanted to note that they've served 11 people. So percentage-wise, I think it's important to raise the question that Julian raised.
Yes.
But it's a new program. And so it may be that they need to get the word out more into the community. So they served 9 individuals who were white and 2 other individuals who were not white. And I wouldn't want to see those percentages again in the future. It would suggest they're not doing the job they need to do. But it may relate to the fact that I believe this is a new program.
Yeah, it's a new program, and I think it has an insurance component also, and sometimes that becomes a problem.
So I'll make one more comment about it, if I may.
Go ahead, Julian.
Just about what you're seeing. Again, for me, the issue is I don't see any conscious statement about what they intend to do, or whether they think they ought to do something, or they think they should do nothing about the demographics as I'm seeing them. Maybe they have a perfectly fine rationale. I just would like to know how they're thinking about it.
That's definitely a good question that hopefully we would have somebody who can touch on that at the end of the review session. Any other comments or hands raised?
There are no more hands raised.
Okay. Thank you very much.
Mm-hmm.
Next one would be the Op Center.
Yes, that's mine. So I remember maybe 3 or so years ago, we would say to them, you're only asking for $19,000. You ask for more money. And then they asked for $35,000. Now they're asking for 60. So they listened.
They listened.
I guess so. And this is another of those unique programs. It's the only program in the county that is dedicated to helping the LGBTQ plus population. And they are asking for 2 program salaries. And then they also use volunteers. But they run, another thing I should say that we asked before was how accessible their program was, because it was running out of the last year out of the University YMCA. And they mention here that they're looking for another place for one of their programs. Another of them is at the library. Another of them is rotating. And they have a good outreach program. I think they mention going to different parts of the county and different schools. Their evaluation tools are still being refined. They're working with the evaluation capacity team at the U of I, which is good. I am concerned about them not leveraging funds more. They've had some fundraisers, and of course right now those kinds of things are being devastated. I tried to match up, I went to their website and tried to match up the programs that they mention here that they're doing. And I think there are 3. There's a parent group, and a teen group and a children's play group. But there are about 11 programs at least stated on the website. And I don't know if those are programs that, some of them were being offered and aren't now, or if they're programs that will be offered in another iteration, or if that's what they're planning to offer. So I don't know what that relationship is. There's a reading group, there's other kinds of groups mentioned on the website, and I didn't know if funding these two positions would make that happen. After all, even this amount of money, I guess, isn't a lot of money for what they're doing. They have a weekly support youth group, a case management program, a parent group, a group for younger people, and so that, I think that would be my main question, is just what is the scope of what they are planning to do for the coming year.
Okay, thank you. So who's the second reviewer?
I'm the second reviewer. I don't really have anything to add, though. I mean, this is a program we funded for a while, and as Elaine pointed out, this is really the only group in the community that has this focus on that group. So I think it's really important that we continue to work with them.
Yes.
Okay.
There are no other hands raised at this time.
Sounds good.
Okay.
So we're moving on to DSC.
Okay, I think I'm the primary, and this is a program that we have funded for quite a while. Its focus area is individuals with developmental disabilities, intellectual and developmental disabilities. So it's part of the DD portion of our mental health board budget. DSC provides services to families with young children birth to 3, and then they continue for some families through age 5 or kindergarten entry. For those children who have developmental disabilities, as well as more noted in their proposal, I think this year, those children who are at risk that don't fit into the current strict requirements for early intervention. So children who are in need of early intervention but don't demonstrate a 30% delay in 2 or more areas are able to access services, or their families are, through DSC. And if they were not able to access those services, they would have greater needs by the time they were either entering kindergarten or eligible for Head Start or pre-K, neither of which services are universal. So the program bridges the gap. It serves children with significant disabilities as well as children who are at risk, significantly at risk for developmental delays. It works through numerous schools, churches, community centers. It collaborates with 8 other agencies. I did pose several questions about the extent to which their services were duplicative or overlapped with the school districts that are also required to engage in child find, and if they served children who also were receiving services from early Head Start or from Head Start or K. And there are a small number of children who do get more than one level of service. And I think that that's inevitable in our community, and that it's because we don't have sufficient wraparound services. So the duplication wasn't sufficient for me to be concerned, but rather appeared to be more of a bridging the gap and providing some wraparound. They are not, they're only going up 3% in their request. So they have been pretty consistently at slightly under $600,000. They use only professional staff. They have outcomes that go beyond parent satisfaction. They collect data on child gains, and they do a random sample and review of files for progress reports. Their budget's entirely personnel delivered. They have an established track record. They served 655 children, which is really significant. It means that they're spending less than $1,000 on average per child per family. It meets a critical need in the community, and it does meet our obligation for developmental disabilities. So I would recommend ongoing funding, 2-year funding for this project.
Thank you, Susan.
So I mean, Susan pretty much hit a lot of the points. As a pediatrician, you know, this is a very important service. I mean, early intervention is a very important service that we have in the community for the kids that do qualify, that have significant delays. For kids 0 to 3 years old, it's usually early intervention that will provide the developmental therapy, speech therapy, and go to the homes and provide that therapy until they're 3. And then once they're 3, they go to the school district. There's just a transfer into the school system and get therapy there. You know, usually when there's duplicative services, it's usually because kids have either a significant enough delay that they need more therapy than can be provided by the school, or the school doesn't have the resources to provide the amount of therapy that the child needs because of the school system or district that the child lives in. And so, you know, I'm not worried about any duplicative services from my experience as a pediatrician. Usually it's because it's indicated. They're not. I've never seen anyone excessively giving out therapy.
Right.
That's not something that I'm concerned about. I don't like wasteful use of the resources. You know, for kids that have mild delays, a little bit goes a long way. And if you treat them early, so like a child at like 15 months old will say 3 words. A child at 18 months old will say 7 to 20. But then when they're 2 years old, they'll say 50 words. And at 3 years old, they're going to say 200 words. If you're behind a little bit at 18 months and you don't get that little bit of therapy then, you're going to be much more behind when you're 2, when you're 3, and then when you go to the school system. And the most important factor in a child's life is their reading level at the 3rd grade. And if they're behind at that point, then they're not just behind in reading, they're behind in math, science, you know, and it's really hard to catch up in everything else. And it becomes a compounding thing where it's a lot, it's, you know, an ounce of prevention is a pound of cure. This is that right there. And so, you know, they service a lot of rural areas that don't have the resources that, you know, they alleviate that transportation barrier, which is really important. You know, I really like that they assessed 100% of these people, children, within 7 days, and then 90% got services within a week of their assessment, which is actually really impressive. So, you know, just this is a really vital service that just fills in the gap where the state is falling short. And I think, you know, the benefits of doing this, you don't see until, like, you'll see a little bit when they're in like elementary school, but you're going to see that long-term benefit 10, 20, 30 years down the line when you have a generation grow up that gets these services, so that you decrease the burden of society later on, that, you know, making these children more capably, have a higher likelihood of being more successful in life. And so I just think that this is just a remarkable service, and I think it's money well spent, in my opinion. So.
Thank you, John. Thank you, Susan.
There are no more hands.
Okay, nope. Thank you very much. So next one will be Champaign Head Start.
So I'm the primary on this one.
Okay.
Sorry. So the Champaign County Head Start is asking for $121,000. It's an increase of about 8% from the previous year. They provide basically social, emotional, developmental services. What they do is they do an ages and stages questionnaire and other screening to do the social emotional screening for the children. And they target children with challenging behaviors or have a high ages and stages questionnaire score. They develop a support plan to teach and teach social skills and help engage in, the children in the classroom environment to help them be more successful in the classroom. They can also offer referrals to doctors if they feel like the child indicates a referral to a physician or provider. They can indicate a referral to the developmental specialists, local mental health agency, early intervention for services, and then the school district for further screening if they're old enough. They provide professional developmental training and reflective consultation to the staff working with these children to help them support the children at their sites. They meet the parents where they are at home in the classroom. Their outcomes are, decreasing those challenging behaviors in the classroom, helping the parents gain understanding of the impact of the stress and trauma on themselves and the children, providing the psychoeducation on stress, during home visits and their family meetings, site meetings. Their goal, the outcomes that they have is they increase self-regulation and initiative of the children, relationship building, problem solving. And then they usually, the parents are surveyed once a year to assess the knowledge, the knowledge of the children. Sorry, I can't read my own writing. Sorry about that.
Oh, if you're a doctor, don't worry about it.
I know, right? If I typed this out, it'd be a lot easier to read. So they have a lot of evidence based criteria that they follow, which is the ages and stages questionnaire, the goal assessments that they do quarterly, the ages and stages they do twice a year in the fall and the spring, the DECA that they do twice a year in the fall and the spring. And their goals are having 90% of the children that are involved be developmentally, socially, and emotionally healthy, emotionally healthy for kindergarten, and 50% that get these services for 9 to 12 months should not require continuation of services, which is their goal, which is great. But it really depends on your population sample. So if your kids have severe delays or require significant services, that's going to be higher. And if they don't meet that goal, that's okay. It's, are they making progress is the bigger question. If they are, then that's great, and that's what we want to see. And so they have 50 new children this year. They've had 600 social emotional classroom observations, ASQ screens, child observations, parent-teacher conferences to discuss the concerns. Again, they serve families in medically underserved townships, and those people receive priority points for enrollment. Hope Springs provides outpatient therapy. CFC links families to early intervention services for infants and toddlers with developmental delays. The Champaign County Head Start works with providers for the referrals, like we had talked about. Again, the funding goes mostly to the personnel costs, which is the social emotional developmental specialist who has a PhD in educator counseling, and the child services manager. They anticipate 130 individual participants this year. And then the other sources of funding is assistance from community providers who accept Medicaid prior to using this contract. So pretty much it's the Champaign County Mental Health Board for this. I don't know if Susan has other stuff to add to this.
So I'm the secondary reviewer, and I agree that the social emotional development funding that we provided to Head Start is really important because for whatever reason, it's not available through Head Start. And resolving social emotional difficulties early on is critical to school success. My question is, I'm still confused about the relationship between this specific application And the other Head Start, early Head Start application, which was number 3 and we discussed last week, it asked for $209,000 and this one asked for $121,000. Again, I think that the program's important, but this one that we're reviewing right now appears to fund the primary coordinator expert in the program and another staff member, and it's coming out of the DD funds, the IDD funds, and I'm just, I wondered why this was split out from the earlier application, because they seem to be very closely related. And so this may just be a technical issue that staff need to deal with. And then secondly, certainly behavior disorders is considered a developmental disability, but I don't remember using DD funds from our budget so much for specifically social emotional services. So it's a question in terms of, does that really represent our investment in developmental disabilities? And I'll just leave it there. I'm not arguing against it in any way, shape, or form, but I'm raising concerns about why these were separated out into 2 proposals. That's it.
I agree with Susan that it seemed weird that you had the coaches, the social skill coaches in one funding, but then like manager, developmental specialist in another separate application. I don't know if it was just the timing of the applications, but it seems like it's one project. Just,
and I think you need both for it to be successful. But so
Julian has his hand up, Joe.
Okay, Julian, go ahead.
Okay, I'm going to lower my hand here before I get the yeah. All I wanted to say is I have had this kind of question for a while, and I just, it's identical to what Susan said. I just want to hear why these are separate and how they work together, or do they work together, or is there some other reason for, since the total between the 2 is not trivial. So I want to know sort of what we're doing there, that's all. But I probably just need the information. That's it.
Okay. Thank you. Thank you, Julian. Any other hands?
Nope, there are no more hands raised.
Okay. So I think we've come to the end of our packet of things to review.
So Joe, that is right. And so if you're ready for agency responses to those questions, you could, I don't know what order you'd like to take them in, but I think all the agency people hung in for this.
As long as they're still here,
so they're
please.
Probably ready to go in whatever order you all want to pose the questions.
Since we just finished up with Head Start, let's do Head Start first, and we'll work backwards.
Okay, so we have, hold on just one moment. Julian has his hand raised.
Okay, Julian.
Sorry, just before we go into agencies' responses, it might be advisable to figure out what the time is like. How much time are we giving per agency? Because
yes,
could talk for a very long time about their own agency, I'm sure.
So would 3 minutes?
Okay, so I will time people at no more than 3 minutes. And if you just say to answer this specific question, that could also eliminate the time as well. But I'll still do it for 3 minutes.
Okay. So with Head Start, the main question is why the 2 separate proposals? Is that the main question?
Yeah, why are they 2 separate proposals and how do they actually work together?
Okay.
And Elise is on the line.
Yeah, hi.
Hi, Elise.
Hi.
Hi.
Thank you for the question. This proposal for the social emotional development specialist actually exists before my time with Head Start. I think Lynn said it has been funded through the GD board for 12 years. Is that accurate, Lynn? Yep. Ish.
I think so. Ish. Yeah.
Okay.
Somewhere around.
And I've only been with Head Start for about 4 now. So I've got a lot of kid activity happening right now. So perhaps it would be better for me to answer these questions on paper at bedtime. Is that possible?
That works.
Okay, thank you. I apologize.
No problem.
okay.
It's all different for everybody.
Yeah, exactly.
So Elise, if you wouldn't mind sending that to me and Kim Bowdry
Sure.
by Monday. Is that
Yeah.
possible? Okay, thank
Did
you.
you say by Monday?
Yeah.
Okay. Yep. I can do that. Thank you.
Thank you.
Thank you.
And then your next direct question that you had was for the Up Center.
Okay.
And you just wanted to know about all of the different services that they were offering that were listed on their website.
Mm-hmm.
Are they actually able to do them?
Sounds good. Is this someone from Head Up Center?
There was someone on, I think William Blanchard was from Up Center, and then also Amy Hines Piper.
Hello?
Yes.
Okay.
Hey, sorry, was figuring out the mute in the video there.
Okay. Go ahead, William.
So yes, we are offering the services that are mentioned on the website, including the book group, the youth group, the teen group, the aging up group. We haven't updated the website yet, clearly, but our social media outreach, Facebook and Instagram, we've been advertising everything that we're doing there. And it has been pretty effective. We're getting quite a few clients in.
Okay.
Okay, thank you.
Okay, thank you.
And then the next one was from Rosecrans, the recovery home.
Mm-hmm.
And it was the questions about their demographics.
Yeah.
And so there is, Joey King is from Rosecrans.
I think there were several Rosecrans questions, so that's one of them.
Yeah, that was one of them.
Okay.
Hello, can you hear me?
Yeah.
Hello, good. On the recovery home, the question about African Americans, we do have 2 currently in our recovery homes, both residing in Champaign County. There are other minorities as well. I want to thank Susan for pointing out that I think some of it was a new program. That was the barrier to it. There is no real assessment, just commitment to recovery. And as the program continues to evolve, I think some of those things will just kind of resolve itself. There was also a question posed about insurance and things like that. There is no insurance requirement for that. That there's any benefit to the recovery home on that, so that won't be a barrier to treatment.
Okay.
I think there was also questions about the criminal justice program, and one of them was, do you have to be incarcerated? The answer to that is yes, but there was a prevention component to that as well, and we do take referrals from probation, so that would be one component that would come out of that criminal justice program. Then on the crisis line, there were some questions, I believe, as well about the whole scope of it. So the crisis line exists not only, and there were some questions about law enforcement, hospital services. The goal of the line is that we want to prevent those things. We want to prevent law enforcement, we want to prevent hospital services. It's 24/7. It does have some clinicians staffed on it 24/7. There is 24/7 consultation with the QMHP, and then also an LPHA will be available. So there's more than just the hotline. There's a disposition, there's consultation, before we make an accurate decision on what's the next step. And after that too, I mean, there is the continuum of care, access to benefits, making sure that after the crisis needs that they have, whether it be therapy or psychiatry or benefits, that we're able to help provide that. I think I jotted down all the questions and answered them. If there's any more, I'd be more than welcome to answer them.
I think you covered the questions from what I remember.
I don't know how to technically raise my hand, but
go ahead, Tom. Your hand is raised.
Yeah, the question I have is in the recovery home. I thought the issue was not that these things will eventually work their way out, but what's the plan that you might have in order to get minorities into this program? What are you thinking about doing? You're just gonna just let it sit there, or you gonna be proactive in trying to get them in there, notify them and get them in there?
That's a great question, Tom. And as we were talking, my head was spinning, and I was thinking about how to do that. There is no current plan for that. I mean, the plan all along has been to just attract anybody who is interested in long-term recovery. But you pose a really good question, but I do not have an actual strategy for that.
So, something like an outreach program would be something you would be looking into?
Yeah.
Okay.
Then I'll just also point out, I know that Joey is probably new to the application process and our process regarding our CLC plan. And so maybe updating him on there are some clear strategies that I can speak with that program about, and we can talk about that.
Thank you.
Okay, thanks. Thanks, William. So any other questions that we had down? I think we're done with Rosecrans.
Yeah.
Okay, thank you. Thank you, William.
There was a question for Rattle the Stars.
Okay.
And it was asking, what is the barrier to provide, what are the barriers, or how are you going to address those to provide those services, because they had run into the challenges with how to offer the training online. So I think there was a direct question of asking, how are they going to address those barriers to provide services? And Kim Bryan is the person, and she's on.
Okay, go ahead, Kim.
Hi, everyone. Can you hear me?
Yeah.
Oh, great. So right now I am scheduling adult training sessions online, and we're doing those through Zoom. I am really hesitant. I've had requests for youth trainings through Zoom, and I'm just hesitant to do it because the youth need a little bit more support and guidance through the training. And so it's something that I'm concerned that if I try to do that online and not in person, that they won't get the full intended benefit. So we do a lot of skills practice, a lot of active listening and communication skills, a lot of practice with scenarios and things of that nature. And it concerns me that with youth, that just won't be as effective online as it would be in person. So the request that we've had for that, we're holding out until later in the year and scheduling those. So we're currently scheduling them for the fall. And so I hope that answers the question. I don't know if you need some more explanation.
And then other questions for Kim.
There are no hands raised.
Okay, thank you, Kim.
Thank you.
I think that was probably the last question that we had.
Yep, that was the last one I had recorded.
Okay. Any other discussions about the proposals right now? Questions or comments? Go ahead, Julian.
It depends on where we are in the process.
So we're just about done.
If we're making a general comment about all of them.
General is fine.
Yeah, so I guess I was trying to think about the sort of question that Susan raised early on in our conversation. I guess what I'm wondering about is I think what we need to have is an understanding among the board members and the staff as to how we're handling the question of requests for more funds. It would be reasonable to expect that every program always thinks they need more funds, but there's a finite limit to it. And I'm not saying they're not all justified. I just think we probably need to have some common understanding of how we're going to decide to allocate them. I don't want it to be driven by a kind of, well, they asked for 100,000 more and somebody else only asked for 50,000 more, so they get more because they asked for more. I want it to be justified on the basis of what we're thinking in our own plan for what we can do to benefit this community the most.
Okay.
Now, of course, I realize that is our goal always, but I think I don't quite know how we're going to handle the funding.
Mm-hmm. And I think we'll take the recommendation of a staff and we'll have that conversation about how those things will work its way out. Because because you ask for $100,000 more doesn't mean you get $100,000 more. It just means that we're looking at a community in general, and based on recommendations of the staff and what they see by being part of what's going on, we will make those decisions, hopefully.
And I probably don't have to tell the staff, but I just want to say it out loud, that I think that what we need to do is decide how we're going to fund programs that are local and small and are going to need money to survive when the state decides they're practically bankrupt.
Oh, come on, Julian. Don't go there.
It's not that I'm thinking that the state would ever think of cutting funding for mental health programs, but I think we might want to be thinking in advance about what we're holding in reserve and what we're ready for emergencies and so on. And I understand that contracts can always be renegotiated, but
yes.
Nevertheless, I just thought I'd get that out on the table and have the staff at various points share with us how they're thinking about it.
Yes, I see Tom's hands up. Go ahead, Tom.
I have a thought that's been running through my head through this whole assessment period, because I realize that I'm mindful of these grants or these proposals were written prior to this epidemic this pandemic that we have. And in my mind, this changes everything completely.
Yes.
I'm not one who believes we're going to return to normal. So if these guys are writing these proposals today, what would they sound like? And how are we thinking about preparing for that, as I think Lynn talked about it earlier, this mental health pandemic that is definitely going to follow the situation that we're currently in. So that concerns me, as well as part of Julian's question about the funding is like, given that the economy has taken a real hit, what is our budget going to look like? When I've talked to Lynn about it, she reminds me that our money comes from property tax. But, you know, next year there's going to be less property than there is this year. So we could possibly be looking at a real hit in terms of what our funding might be. And one last word, one last thing that seems like it might be disconnected from this, but you know, we've heard in the news about how African American communities are really hit by this pandemic, and medically they're suffering, which is going to lead to mental health problems. And I'm also mindful of Francis Nelson was started in the African American community, so in fact they would have services of mental health and physical health, and now it has grown. So we had that opportunity, and I hope we still do have this opportunity to meet those needs. And I know the director is also pays attention to that, but we should remember that this community was ahead of the curve on those kinds of things for,
yes,
I don't know, 40 years or so.
Yes,
So don't forget that.
Okay, thank you very much. Any board announcements? Oh, Susan.
Susan has her hand raised.
Go ahead, Susan. I
Yeah.
did not see that. I'm sorry.
I can't do it mechanically now. I just wanted to follow up on both comments from Julian and from Tom. I know in the past we've had a hard time not funding at requested levels, and staff have been vital to assisting with that. But I think that given the pandemic, we may want to be conservative in funding so that we have some funds in reserve for unmet needs yet to come forth. And it's not that we shouldn't spend a good portion of our budget, but we typically hold back money in reserves. And I know that we've just been going through the issue with the property tax and one of our local medical centers that may impact how much reserve we have. So I'm just bringing up the issue of let's err on the side of caution rather than on the side of full funding because of what may happen in the future. We may need some reserve funds.
Makes a lot of sense. Thank you. Thank you. Any other announcements or comments before we move to adjourn?
May I ask a technical question?
Go ahead.
I noticed that there were various chat things happening. I don't know how to access those to see what they are.
So I would like to ask that people not put anything in the chat other than signing in, because for exactly that reason, like you're all working on really different devices, so board members can't always see what has been entered. I did want to ask if you want me to respond to any of your comments with just kind of where I'm at today regarding staff recommendations. But I'll tell you what's in the chat box. It's from Nancy Carter saying she wants NAMI to know that the Family to Family online program, as Jane mentioned, is now offering more family support groups online through Facebook, Instagram, and Twitter. Those levels are off the chart with individuals wanting to be engaged with NAMI. So that's the thing, that's the comment that appeared in the chat. I don't see any others.
Thank you. Thank you.
So did you want me to respond at all to the issues you were just discussing?
Oh, I think you said you will be doing a lot of writing, so just respond in writing, send it to us.
So next week
we'll read it.
Okay.
We'll read all about it.
Okay, great.
Okay. Anybody move to adjourn?
I move.
Make a motion and we adjourn.
We did a second.
Second.
All in favor?
Aye.
Aye.
I just wanted to make sure that if you did not sign in the chat box, just make sure that you do with your name and agency before we log off.
Not board
Not the
members.
board
Not
members.
board members.
You're
No.
good.
Okay.
Okay.
Okay, you guys have a,
I can leave now, Sean?
yes, you can.
Bye, y'all.
It's good meeting all, I'm seeing all you guys
It's
again.
good seeing you.
Thank you, everyone.
You take care now. Bye-bye.
Bye.
Lynn, it's a few people still signing in,
I'll
so.
stay. I can stay on. Wait. Yeah, I can stay on till everybody's done.
Okay.
Good to see you all. Bye.
Bye. So. Bye.
All right. Good job, Lynn.
Yeah. Hey,
Okay.
Chandra, we're still being recorded. But
I know,
sent
that's
you,
what I said. Good job.
well, I sent you a lot of messages just before the meeting about a couple discussions we can have.
Okay. So I will be in tomorrow.
Okay, good.
Friday, so
okay.
I'm not going to take off. So I will be, yeah.
Great, then we can cover my 3 or 4 topics in the next couple of days. Thank you.
No problem.
Okay,
all right, bye.